In 3, 2.
Welcome to the Better Than Yesterday Everyday Podcast, where we cover anything related to behavior change that will increase your long-term wellness and happiness. And now, here are your hosts, personal trainer and RNs, Matt and Jenna.
What is happening, everybody? Welcome back to the Better Than Yesterday Everyday Podcast. My name is Matt.
And I'm Jenna.
Super excited about today's episode. We're talking about sex. Yeah, the taboo thing that's not often talked about.
Excuse me, everyone. Sex! Now that I have your attention.
You don't have our attention.
Money!
I'm listening.
You had me at sex.
Yes, sex, sexual health. We want to talk about it. Episode 50, we had Dr. Croley and nurse practitioner Jerry on, and we got him back on today talking about sexual health. I'm very excited because we haven't gone into this realm in 61 episodes yet. So this is very cool to me. It's uncharted territory. Let's do it. What are your thoughts on this so far, Jenna?
I think it's going to be a good subject. I think we're going to be able to cover a lot.
It's going to be fun. It's going to be fun. If you're new to this podcast, thank you for sliding by. I truly appreciate you. My name's Matt. I'm a personal trainer and a registered nurse. Jenna's also a registered nurse. We started this podcast not too long ago, and it's been an absolute blast. So having our guests back on today to talk about sexual health is going to be fun. So Chris, Jerry, tell the people hello again.
Hi there. We're so excited to be back with you guys today. This is a really fun topic for us as well. And in our practice, we've been able to kind of explore different realms of sexual health. And it's actually been surprising to both of us how many people have issues with sex. It's something that we all want, we all enjoy, we all need as a part of a healthy lifestyle. But surprisingly, there's a lot of people that have issues with it. So we're thrilled to be here with you guys today to talk about this and some of the options that are out there to help your listeners get the help that they may need.
Yep. There's a lot of options that we were unaware of. There's a lot of things we're going to cover. Anything you got to say, Jenna? Trying to get Jenna a little bit more into the role of her role as a co-host here. Go ahead.
Thanks for putting me right on the spot,
Well,
Matt.
Of course.
So those of you that don't know, we have another YouTube channel. It's Matt Lane Fitness. You can like and subscribe. We've got a Patreon and that kind of stuff.
Good job. Good first try. So basically, if you want to support us, we have a Patreon page. It's going to be linked down below. Also, the YouTube channel for this episode, there's a visual to this. If you're listening to it on Spotify, Google Play, iTunes, all that, there is a YouTube version of this. We'll link it down below. If you want to support us on Patreon, awesome. If not, we appreciate you being here. So at the top of every show, we hit you with our... I almost hit the wrong button. Did you see that? I almost hit the intro again. This is the gratitude point. The gratitude point is something that shifts your perspective. It can be something small, something large, something in your life that will pull you up out of the dumps if you think the world is just falling. And it's not. It's really not. Jenna, you want to go first?
Yeah. So right now it's really nice weather outside, and
Yeah.
I've been, when I get up in the morning, I've been sitting outside and drinking my coffee instead of just sitting in the kitchen. It's been really nice hanging out with the dogs outside and getting some fresh air. And, I'm really grateful that it's, been nicer weather for longer. Usually it seems like it's about a week that Pensacola has tolerable weather outside before it gets super humid and hot. So I've enjoyed this longer period of tolerable weather.
Reaching and finding those little pieces just in everyday life. It's so corny, but it's so true. It is so, enjoying the Florida weather. It's true. Mine's a little deeper. But that's the cool thing about this perspective shift or this gratitude point is that it can be large, it can be small, it can be deep, it can be whatever. I'm happy for the farting dogs below us. It's, it's whatever you want.
It smells so bad in
yes,
here.
It is. But I'm very happy to not have validation all the time. And what I mean by that is whoever you are, wherever you are, if you're listening, watching, if you're working on anything, a degree, a business, your body, sexual health, not having the validation piece if you haven't succeeded yet or if you haven't achieved that goal yet, that not succeeding, not having the validation makes it so much more beautiful for when you actually get the validation Does that make sense what I'm saying?
Mm-hmm.
There's someone out there, and you know who you are. I'm speaking to you right now. Not having this validation, one day you're going to appreciate it when you have the validation. Chris and Jerry, if you have a gratitude point, hit us with it. If not, no biggie.
Yeah, it's actually, it's hard to pick one because there are so many things that I'm grateful for. Playing off of Jenna's comment on the weather, I'm very grateful for the good weather and our farm right now. I've thoroughly enjoyed the past few weeks being able to plant and garden and just enjoy a little bit of time away in this quarantine that we're in right now, and just get to enjoy our property and some of the nice weather that we've been having.
Yeah, because Chris is a doctor. We used to work in the ICU together. He's still there. He's a fantastic doctor, by the way. But my gosh, this man works a lot. You both work a lot in your own private practice, but you both work a whole lot in what seems to be 18 jobs. So I'm glad for you. I'm glad for you. Yeah, Jerry and I have been talking, so I'm glad to see y'all taking some quote unquote downtime.
Yeah,
even if it wasn't voluntary.
Yeah.
Yeah,
not voluntary.
and I think that's one of the things that, you know, when this all started and with the COVID crisis, and we were told that our business was going to be temporarily closed, and we really didn't know what we'd do, how we'd spend our time. And Chris and I have both been together a lot more than what we normally are. We work together, but when you're together and you're not working, it's by choice, whether we're doing projects side by side in the yard, or if he's doing a project in the garage and I'm out back working in a garden or something. We both know that we're here and we're here by choice. And so it's been nice just to kind of earth a little.
Yeah, earth a little. I like it. Yep, you're 1,000% right.
Yep.
Well, diving into this episode, I think it was an important question to ask. Sexual health, I think when people hear the word sex, they immediately think of a taboo piece. But there's so much of a sexual health side that's in healthcare, but there's also a piece in the brain. There's a mental part of this. There is a behavior change piece behind this. So there's just so many realms. Let me ask you both, what do you think, like, what is sexual health really?
I think that, just like you said there, that's a pretty complex question, because it's not just the physical portion of it, and it's also not just the mental portion of it. It's actually being able to maintain or to reclaim both that physical and emotional component. And if someone is lacking something emotionally, then a lot of times physically that component's not there, and vice versa. If there is some type of physical limitation to the sexual component of it, then one of the two partners is going to be lacking, and it's going to affect. So it's a snowball effect. I think if you don't have all of those pieces and all of those pieces working together, and if you don't have the support of your partner, then you're not healthy sexually.
Yeah.
And so there are, as Jerry mentioned, there are physical components that, all the parts have to work right for people to enjoy sex, right? So there's physical component, which can be impacted by actual medical problems. So we won't delve a ton into that today, but we don't want to neglect pointing out to everyone that there could actually be medical issues that would need to be followed up on and worked on. Sometimes sexual problems, the first sign is, it may be the first sign of some physical problems like vascular disease, diabetes, some issues like that. And so we do include that as part of a workup when we are evaluating patients that are having sexual health problems. And then obviously there's a whole host and realm of sexually transmitted diseases that can impact your sexual performance. And by no means, because we're not really talking a lot about that today, do we want people to think that that's not important, because if you see us in our office, that is part of our question screening and workup. And then the fun part is trying to figure out, once we figure out what the issues may be, is coming up with a plan to help get that patient back to normal, whether that's, something to improve their mental health. And we're not counselors, so helping people identify the resources that they need to get that counseling in the community, or saying, hey, we have some options here that we can help you with, procedure wise, that's going to improve the performance. That's actually the really fun part of our job. So.
Okay.
Can you tell us what procedures you do?
Well, so maybe the procedures that you do, and then I'm going to piggyback on that and say, what do you think, what's the most common things that you see when it comes to maybe sexual dysfunction, if that's the correct term?
Sure. So it depends, male versus female, and the age range. So we obviously kind of have a whole range of things that we see. But for our male patients, we typically see either difficulty achieving an erection, or either attaining that erection throughout the sexual process, throughout intercourse. They may be able to get an erection, but then they can't maintain it throughout. And then for our females, we see a lot of issues with, I would say if we had to pick one, I would say lubrication issues are painful intercourse. It's just not enjoyable, especially with some of our perimenopausal patients. They have vaginal dryness, which then, of course, sex is not as pleasurable for them as it once was before. It may actually even be painful, not just uncomfortable or dry, but actually painful. And so trying to identify what some of those underlying causes are, then we can help come up with a plan on how to treat that. Sometimes it's procedures that we can do actually in the office, and sometimes it's referring out to other specialists, whether they're in the gynecology realm or urology. There's a whole host of specialists that we work with and refer patients out to. Procedure-wise, to your question, Jenna, the procedures we offer, there are several, but primarily we offer the P shot, which is the pre-Epis shot, and that's for male patients. It is a procedure that uses the patient's own plasma, so it involves a blood draw. We separate out the plasma component of that, which is full of growth factors and stimulates some angiogenesis, which is just a big fancy word for blood vessel growth. So it improves sensation. It improves the ability to achieve an erection. But one of the side effects is usually increased size. So something totally separate than dysfunction. We have a lot of our male patients will come in and they've read about this procedure, they've seen it in a magazine somewhere, and they don't want to tell us right away that size is their main concern.
Sure.
But then we find out that that's actually what they're there for. And so we don't promote this or advertise this as a treatment for size, but one of the side effects, if you will, of the treatment when we do treat erectile dysfunction is usually you have an increase in girth and maybe a slight increase in length. There's an equivalent for our female patients called the O shot, and it is a procedure that involves also drawing blood, selecting out the plasma portion of it, and injecting it into the vagina in a very specific way. It improves their sexual, pleasure. A lot of patients will say that they achieve orgasm much more easily. So women who have never been able to achieve an orgasm with actual penetration, they'll say they need to do something, either with manual or oral stimulation to have an orgasm. And so they don't even know what it's like to have an orgasm, having actual penetration from their partner. And so this procedure actually does help that tremendously. We see a really high success rate with that. It also helps with lubrication and some with stress incontinence. So there's several benefits that we get from that. And I think that covers kind of the majority of it. We do plasma procedures for a number of other parts of the body, not just the penis and vagina. So we do it, commonly in the face for our vampire facelift. All these procedures that we're talking about are trademark names that were developed by Dr. Charles Runnels pretty close to us over in Fairhope, Alabama. He's a brilliant guy that's trademarked these procedures, and we've been doing them for a number of years now with a pretty high success rate. You have anything to add, Jerry?
I think you covered it.
Yeah, I honestly, you made a good point. I never even thought about needing to refer people out. You've discovered other problems as you screen these patients to other specialties. That's interesting. I never even thought that would be something that you would need to do.
When you're in the realm that you both are in, it's clockwork for y'all. This is what you do. When you're not in that realm, so for us, it makes absolute sense when you say it, but it's not something you think about. If you're diabetic, if you have coronary artery disease, if you have coronary artery, oh my gosh, CAD. If you got the CAD, if you have some of these comorbidities, how it would majorly affect it, just like those comorbidities affect other aspects of your life, such as your lungs, such as the other organ systems that you have.
Yeah.
For our P-shot patients, going to the underlying issues, we don't just bring them in and do the P-shot and send them out and say this is going to work. We encourage a heart healthy diet. We encourage them to walk at least 20 miles a week, and that's a lot for a lot of these patients. We get them started on some CoQ10. We evaluate medications that there could be side effects of some of their medications, or their underlying issues that they have as far as, like you said, coronary artery disease, which, is the number one leading cause.
Show off. You can just say it the first time. Go ahead.
You helped me practice after those 3 tries. And so, the coronary artery disease is the number one leading cause of erectile dysfunction.
Wow.
And also with age, that it increases, 10% per decade of life after the age of 40. So 40% of 40-year-olds have some degree of erectile dysfunction, and so forth and so on. So, 50% at 50, 60%. And then you have the baby boomers. That's still a really young, active generation, but they're in their 70s now. So 70% of this generation is still active and out and going. They're suffering from erectile dysfunction.
Wow.
To some degree. And so that's pretty impactful on someone's life.
Yeah. Mm-hmm. Yeah.
And so if we can tell them different ways to help it, even we call it penis health, to prevent it, the P-shot and, a healthy lifestyle, then, we've done our good deed for the day.
That's again, when you're not in that realm, you just don't know. But those numbers that you just said, that's so high. And sex is essential to life. It's obviously it's very overpopularized and overpopularized, and social media and how it just takes off, and it becomes like this thing that's no longer a piece of health. Sex is generally looked at as just, it's a fun thing you do in your 20s, but that's so not the case, so that's really impactful.
Yeah.
Yeah,
I like that y'all said it's a whole thing where, like, sexual health is kind of a taboo subject, I think, even though you see it, in social media and movies and all that, but it's got that snowball effect of, like, you're not performing like you used to or like you would want to, and then it affects your confidence and then your relationship.
Yeah. And that's definitely a realm we wanted to dive into, and I think this might be a good segue. You guys know me, I'm ADD, so we could be all over the place with this, but so thinking about the mental aspect of that when it comes to, like, a partner relationship, and how the difficulties there of, first of all, communication itself in a relationship is, I think, one of the utmost important pieces.
And probably one of the most difficult.
And it absolutely is. I don't know what the quote was. I'm not going to be able to cite it, so I'm just going to vomit it out here. But I remember reading something somewhere. Basically, the point was, the top 3 pieces were money, sex, and communication. Those were the top 3 pieces in a relationship of why a divorce happened. A lot of that to me just means communication. So in this realm that already seems to be misunderstood, how much have y'all seen in differences of age? Let's start there. Have you seen younger generations more apt to talk about it rather compared to, the older generations?
Yeah, I don't think so. and that may be a trend nationwide. In our practice, we haven't seen that.
Okay.
What's been really kind of interesting, and a lot of people ask, how in the world did you get into sexual health? Like, you know, from critical care and doing a med spa on the side, which is Jerry's primary business. How did you venture into this realm? And so just to kind of, you know, clarify that, we have the equipment, we have the training and the knowledge. We do a lot of other plasma therapies for anti-aging, rejuvenation, and that's how we got into this realm. But it's much more complex than just looking at doing the procedure portion. So once our patients found that we did this, and we have a fair number of middle-aged to older patients. So I think, you know, and being totally transparent, we already had a relationship with many of these clients or patients that would start talking to us. So in terms of, you know, just coming in off the street and meeting, you know, a doctor or nurse practitioner for the first time, you know, maybe that will be easier for the younger generation, but our patient population, a lot that we treat are ones that we've had relationships with for a number of years. And so they do feel comfortable discussing a wide range of health problems with us. But I really haven't noticed a difference in age group, because we do see our younger patients that come in and they'll beat around the bush. It's very taboo. They don't want to go straight to this topic. They'll ask about a million things. And some of the ways that we've tried to help out and destigmatize, especially with our female patients, we have books about the O shot that we just sit around, that's free for anybody to pick up and grab. And we'll notice a lot of times people will take them and they have them, you know, kind of discreetly at their side or with other papers, so it's not obvious. And they can take it home and they can read about it in their own time. And then that will open up the conversation for the next time they come. So we do find that helps with older and younger patients. But, you know, I don't know if you have a different take on this, but I haven't seen a big difference in the conversation piece and who's approaching us for that. They're approaching us for different reasons. What I've seen a huge difference is the young guys that come to us, almost always we get, like, when I say young guys, I'm talking, you know, 20s, early 30s. We find many times that they're coming to us because they are having, or they have read something and they want improved size, whether it's girth or length, and they never want to say that. And then that's something that we tell them, we're not guaranteeing that. We're not doing this procedure for that purpose. And so we usually don't find that out until after the second or third visit, because they'll come and they will talk about some other issues that they may be having. And then the more we talk, we kind of find out that that's it. And that seems to be a little bit taboo. Guys don't want to talk about size, but then that's really the reason that they've, you know, seen in whatever, Men's Health or some of these magazines that they picked up and read. They've heard about this procedure and they see that we're on the provider list in our area to do this procedure. And so they show up and then beat around the bush, and we find out a visit or two later that, you know, that's why they're really there.
Yeah. There's such a comfort piece behind it, I think, for the patient. You know, I mean, I think it's much easier to talk about your high blood pressure than it is your sexual health. And I honestly believe that's because of the stigmatism behind it and what we've done as a culture. And this is not pointing a finger at culture, but it is what it is. So that makes sense.
Yeah, I think those conversations are very exposing.
Extremely.
So it makes sense that it takes a couple of visits for someone to get kind of used to you guys and really dig down and, you know, find the real reason why they're there.
We encourage all of our patients to bring someone with them. Up to this point, we have, and we always encourage to bring a spouse with you or whatever, your partner, and you'd be surprised how just having, even though our goal is not to moderate the conversation between them, you'd be surprised what they talk to each other about with us present that they wouldn't talk about without us there. And we do a lot of these shots as a couple, like both partners will end up getting the shot, and they do tend to have really good results because at that point they've discussed issues that each are having, that are concerns. I shouldn't even say issues. And so I think that when they're there and with someone to kind of help move the conversation along, because ours is, it's a questionnaire, a 5-question questionnaire for one, and then there's one that's a little more lengthy about lifestyle and evaluation of, you know, comorbidities, that sort of thing. So that kind of goes into the communication and emotional part, Jenna, that you were talking about earlier.
It's really cool that you inadvertently, I mean, you're changing behavior while you're doing this. I don't know if you guys have looked at it the way, but that's the way I see it. I mean, there's a lot of, and not to plug this podcast, but I mean, that is what this podcast is all about, that behavior change is just so huge. So y'all are inadvertently changing their behavior. It's incredible. Good for y'all.
Yeah. It's almost like a therapy session.
Yeah.
Kind of added.
Well, that's what we say.
bonus.
We're clear that we are not therapists, and there are plenty of good ones in our area that we will refer people to for that. But it's interesting that, as Jerry said, moderating that conversation, it does open up a lot of topics that they may not have talked about with each other. And just by us asking the question in a clinical manner, and the partner hearing that answer, then you realize, and clearly people have the right to privacy. So if they don't want to bring their partner, then by no means do we force that. But we do find that when they will do this together with their significant other or their spouse, that it opens up a lot of communication pieces, because it is not a simple come in and get a shot and you're all better, right? There's many components to this. This is one tool that we have to help you get to a more optimal sex life, but there's hormonal issues that we may have to address, right? So hormonal imbalances can contribute to these problems, as we talked about earlier. Physical conditions, hypertension, or high blood pressure, coronary artery disease, that can all contribute to these things. So it's a kind of a multifactorial process. And so we talk about that and other things that they can do. So whether it's through moderating these conversations and then they go home and they delve deeper into it themselves, or they go through a professional counselor to help moderate that, that's that individual patient's options.
Okay.
But then if they, even if they start saying, hey, we know that this is going to improve this aspect of our life, and that's what motivates them to get out and start walking every day, because they know that they will have better results. If they come in and pay for this procedure and they know, hey, I walk 20 miles per week, I'm going to have a better result from this procedure because I'm improving my overall health. That may be all it takes to get them to get out and start, walking, exercising, improving their diet, eating things that are, healthier for them. Not the tub of cheesecake that we talked about right prior to the podcast. So if we can help in those aspects, it's great. And we find that often, they may come for the procedure, and we've had patients that come in for the procedure that we don't do the procedure. And we have many that we say they're not a candidate, or this is not actually going to be optimal for you, and but they will make all the other changes, because we can say, here are the things that you can do in the meanwhile. And we're happy to do that. It's a really, when they come back to us a few months later and discuss the positive changes they've had, we're very happy with that.
Yeah, what a motivator. Not just to exercise and eat differently to change the way you look, but to change the way you perform, I think would be a great motivator.
Well, I've always said, at least for me with fitness wellness, you truly have to have a real why as to why you're going to do it. That is going to be your motivation. That's what's going to continue you in those dark times when you're not doing it as well. Having your why, for a lot of people, it's having a physically better body or being healthier. But what a motivating why for someone to have better sexual health. And like you said earlier, Jerry, and we've said this a billion times on this podcast about the positivity snowball. Starting with just that walking, and then that leads to, okay, you can have that procedure, and then from that procedure you do have increased confidence, and okay, I guess I will start working out and I will start eating better. It's a positivity snowball. So that's so cool.
Yeah. I like it.
Yeah, right? It just rolled in my head. You see that? So let me ask you, what do you think, have you had anybody reach out to you, Bill, wanted some information, was maybe fairly cryptic because they were, maybe embarrassed by it, and has not come to do that?
Yes.
Okay.
Yes.
Okay. What do you...
Sure.
Go ahead.
We get the strange calls a lot, and I think some of this is driven, these procedures, because they're trademark procedures. There is a website that you can go and look for approved providers, and we do show up. And so I think people will see it advertised when they go look, they find us. So those we find are very cryptic in the beginning, because they kind of want to know who we are.
Sure.
What do we do?
Sure.
What are our credentials? How many of these have we done? And, so they may not tell us right off what they're calling for. They're fairly cryptic with it. And that tends to be more common in the younger guys.
Okay.
when you asked earlier about some of the disparities in patients talking to things about us, once they get to us, they're usually okay. But you get these calls that either never, materialize. They're just getting some information. But the other thing that we do is, I think there are plenty of qualified people out there doing this. And so some of the calls that we've received have been fairly cryptic, and they either may know one of us or friends of ours or family of ours, and they want help, and they see that we offer the help that they need, but they also may be a little bit uncomfortable coming to someone that they know, and and so also we refer out to other providers who do the same procedure, because we truly both want people to be better, and we like that part of our job, and I don't feel like they have to only come see us to get an evaluation or a procedure. There's other people that do it, and so if we can help them in that way and send them out, we refer them. Interesting enough, by doing that, a lot of them end up coming to us, but it may take a month or two and multiple phone calls, and then they'll end up showing up and saying, we've called around, or we've decided we're comfortable with you doing it. But there's a fair amount of those cryptic phone calls in the beginning, and we always try to tell people, if they'll, I don't think there's any way to really avoid that. But we could get to the final goal much quicker if they would just tell us what they were calling for from the beginning. Here's the issue I'm having, and let's talk about a plan on how we can start working on improving that.
And that makes sense. And I pride ourselves on always keeping transparency. So if there's somebody out there, especially if you're a young male, and you aren't contacting healthcare providers that can provide this, and it would improve your health, all transparency, I've had this procedure done, and it was fantastic. And it wasn't, it wasn't as weird as you think it may be. So if you're out there listening and you're contemplating with it, I encourage you to at least make the phone call. Just like that getting started piece is maybe the most awkward piece, I guess, but I was very fortunate, having the providers that I had, but just in transparency, just do that. Go towards that uncomfortable piece.
Mm-hmm. Yeah, I can see how it's very exposing. I think a lot of people judge their self-worth on their sexual health. So kind of admitting that you might have an inadequacy, I think maybe translates in some people's minds of I'm not good enough or that sort of thing.
That's a huge point. That's a piece of micro content. Good job.
Yeah, I think that's I think it's a great point. And I think, playing on that a little bit more is not necessarily there's even an inadequacy, but that there could be some sort of, improvement. And I've talked to you guys privately about this at different points. And we've had our clients that come in, and we will have one partner or spouse want to book the procedure for their significant other because they think they're the one having issues. And when they come in, after workup conversations, we find out that it actually may be the person that was referring the other one that has the issues, and they're just not, communicating that. So it's not, there is a feeling of inadequacy, and sometimes it's, with a male, it's fairly obvious, right? They either can't get an erection or they can't maintain the erection. They have difficulty with ejaculation, but it's something you physically either see or you can't perform. With females, it's a little bit more difficult because a lot of them may be uncomfortable with sex. It may not be pleasurable for them, but they end up continuing to do this for long periods of time to more or less try to keep their partner happy.
Yeah.
And so, it's not always an obvious outward sign like we can see in the male patients where they can physically tell us, hey, this is not working. We can't do this. Whereas the females, they can still a lot of times physically have sex, but they just may not enjoy it. They may not be, having orgasms, or it may not be to the level that they think. And so then they feel there's something wrong with them internally. So emotionally they start, thinking, why is this me? Why am I inadequate? And they don't realize that there are many effective treatments out there for a lot of these problems. And so, the inadequacy piece, as much as that's how many people view it, I always try to say it's, not necessarily that there's anything wrong with you. This is just part of the aging process, right? It's like every part of our body that ages as well. And so we don't think anything about coming in and getting threads or fillers or Botox or chemical peels, all the stuff to our face and our hands to make us look more youthful. But then, you move down south a little bit and it gets taboo and I'm inadequate. Something's wrong with me. And it's like, actually, there may be something wrong, but much more commonly, this is just part of the normal aging process. And we need to talk about what options we can do to help you, male or female, improve it.
Yeah. Yeah. I fully encourage you out there to have the courage to move forward and have that conversation. Just start the conversation.
Matt, can you comment a little bit since you had it?
Absolutely, I can.
The pain associated with it, because I think that's the other big taboo topic. Everybody hears about injections and the penis or vagina, male and female, and they worry immediately about the pain involved with the procedure. And it's not a day at the spa. I mean, it's not a comfortable procedure. We do different things to numb it and to make it more comfortable. And so, would you just comment a little bit on that?
So I'll be honest, I had full intentions to say that I had the procedure done. I didn't know if you guys were going to be cool with me saying that I had the procedure done. So that's why I kind of left it kind of cryptic. So I'm glad that you wanted to delve into it because y'all know me, I'm an open book. So I was very interested to see what it was. And there was, of course, an anticipation. Any male that says, you're going to take a needle to me, I mean, that's kind of intimidating. It's a little nerve-wracking. However, when you're surrounded by healthcare professionals, it brings the anxiety down. It does for me. Granted, I've been around healthcare my entire adult life, but yes, very small needles. I was numbed up with just like this cream, and it was 5 spots of injections. And the first injection was the worst, but it was the anticipation. Yeah. Once the first injection was done, the other ones, I was like, oh, I'm good. And it was so much more built up in my head than it was in pain.
You like broke out in a sweat.
Absolutely.
You lost the color in your face.
Yeah, heck yeah, without a doubt. Take a needle down there, but it was not bad. It really was not.
And we usually hear that. We do ask patients all the time that have had other procedures from us, Botox fillers, et cetera, to kind of rate their pain in comparison. So we kind of know that, what is it like? And most of the time, this is on the lower end of the pain scale. And people have it built up in their head that this is going to be the worst thing they've ever got. Yeah. And we do find that it's not nearly as painful as people build it up to be. It's very tolerable procedure.
Yeah. So on a scale of 1 to 10, 10 being unbelievably painful, 1 being nothing, it was maybe a 2. I mean, it wasn't bad at all.
And 2's consistently what we hear with both our male and female patients. The O-shot patients consistently say a 2, wouldn't you say? And I would say the P-shot guys are somewhere between 2s or 3s.
Okay.
So it's nice to hear.
Yeah. Yep. Without a doubt.
Now, go ahead.
Yeah, for women, I mean, as we were talking more about that, if you look in the O-shot and I know a lot of people are listening to this, so we don't have graphics to see, but basically we're going to go in, if you were looking straight into the vagina, we go at the 12 o'clock position or right at the top of the vagina. And so that is between the opening where, you would have intercourse and the area of the urethra, which is where connected to the bladder where you pee from. And so in between that area is where we're putting the actual plasma. And one of the things that was originally looked at and performed for was stress incontinence. So the more, with age, with childbirth, the more kids you have, the higher the rate of incidence of stress incontinence. And for those of you listening that aren't aware of what that is when you cough or sneeze and you get a little bit of leakage of urine. And so by putting this in that area, it provides a little more structural support. It does, kind of tighten up that area a little bit and improve stress incontinence. And so that was one of the things it was originally used for. And then as a kind of a side effect, it was like, well, our sex life is better. There's more lubrication. It goes in the area of what we call the Skene's glands, and that's the glands inside the vagina that are responsible for producing lubrication. And so that is the area that this plasma is being injected to stimulate that. And so you will usually have increased lubrication. And then that's where 80% of the product goes roughly. And then we take another, small percent, 15 to 20% of it, and it goes directly into the clitoris. And that actually will, change the position of that just slightly. It brings it a little more anterior, makes it more easily stimulated, and also increases the sensitivity. So the ability to have an orgasm is greater after this. And a lot of our patients have had multiple children. So they do have some degree of stress incontinence that they're wanting to treat, or they're perimenopausal, they have a lot of dryness. And so you can see how this works on multiple aspects of problems that you can see with the older female patients. And one of the things we didn't touch on that I think is, just an important thing to throw out there for men as well. There's a condition called Peyronie's disease. We didn't know tons about Peyronie's, I'll be perfectly honest. It's one of the things I remember from med school, but it's basically a curvature of the penis. It's an abnormal curvature one way or the other. And this can start out as something very mild, and it can get severe enough that, you can have really significant curvatures or bends in the penis to the point that you're unable to actually have sex because it's such a severe curvature, or that it's painful, or that you cannot get an erection because it hurts if you get an erection because of this severe curvature. I don't know if you want to add anything on.
The last thing you were just speaking about real quickly, why is it that there's that curvature?
There are multiple reasons that it can occur. It's been the most common is because of an injury to the penis.
Okay.
And the tissue, the scar tissue, develops and forms a plaque. It's also been associated with autoimmune diseases, different autoimmune diseases. And there's even I read an article recently that some people have a genetic predisposition to Peyronie's. And so I don't know exactly if that's because of the type of tissue, or not sure, but there are multiple causes. And it's really difficult to treat because usually people don't recognize it or realize that it's an actual condition until it's pretty severe and causing problems. And so Dr. Runnels started treating Peyronie's with the P-shot, with the plasma therapies, several years back, and has had some really good results. And we've now, just like you, Matt, I saw him personally for Peyronie's. And it was a mild case that was treated with a P-shot and pump therapy. Yeah. And so, it kind of goes back, we were talking about, maintaining. And so I think that's where the P-shot in this disease comes in, is that you may not be able to completely correct any kind of issues, but you can certainly maintain and prevent. So,
yeah, I think one of the urologists that I heard talk about it gave a really, I thought it made it very simple in my mind. One of the ways that, because you think trauma or injury to the penis, and it's like you think you would know that, right? So if you have a major injury, we're going to all know it.
Sure.
But one of the things that we don't think about is in our late 30s, 40s, 50s for sure, most of us are not having erections at the same quality that we had in our 20s. So it's still hard, it still functions. We don't have, you're able to get the job done. But if you actually, were to measure like objectively the tensile strength, you find that it's not as erect as it was in your younger days. Yeah. But you still continue to have sex as vigorously as you did at that age. So you're not in the age range yet that you probably can't physically perform the same way. So you're still trying to do things the same way, but it's not quite as hard. And so you get this little micro trauma where it bends or pulls or tugs, and to one side or the other. And that repeated micro trauma causes little plaques to build up in that area, which can contribute to the curvature. And that's, one of the urologists I heard talk about it. I said, well, that makes sense, because I'm thinking, how does this many people have it? And because it's such a taboo topic, people, and I want to clarify just for the listeners out there, Jerry's comment, that that he saw Dr. Runnels for Peyronie's, and he said, as you did, Matt. Matt did not see Dr. Runnels, and it wasn't for Peyronie's. Jerry was just meaning like individually.
No, it's all good.
Yeah.
That he had sought treatment for that. It sounded
Dude,
like
you both know it's all good. I'll put anything out there. No, you're good. You're good.
Well, I know. I just wanted. I mean,
No, you're good.
Like I said,
I didn't
all
realize how it
transparency.
sounded.
It sounded like
No,
that.
you're good.
But, he had the treatment done for that, and his was associated with an autoimmune condition, psoriatic arthritis, which is very common. That with autoimmune conditions, you can have this as well. Most commonly, as the curvature starts to happen in people's 40s, 50s, they may notice a small change. Their partner may notice a change, but it's not severe enough that it causes anything. It's just something that's different. And then it continues to worsen. And when it gets really severe, is when they will seek treatment. And that's why I like to bring it up. I like to talk about it when people will listen, because, we do find that people will tell us that, oh, yeah, I have that, or I heard about that. And then if they get treatment earlier in the course of their disease, it's usually much easier to treat than when it gets severe enough that they can no longer even get an erection because of the pain.
Yeah.
At that point, we send you to a urologist. There's all sorts of things, and maybe even, surgeries and surgical procedures that they may have to do for this condition. And so it's not something that's simple to fix if it gets pretty severe. So early on, we can try plasma therapies. We need to, look extensively into what could be contributing to the cause. And many times it will involve a urologist evaluating you for that condition. But just knowing that this is a common condition and something that there's treatment options out there, I think for your listeners is really important. So if anybody's out there that has this and they say, hey, I'm in my 40s or 50s and I've started to notice a change in shape, a curvature that may be different, go and get evaluated for it. Don't just think this is going to go away, because it could get worse and the treatment's going to be more difficult.
Yeah, and so for me, and I think there's a clarification and transparency in this. Having this conversation, starting this conversation is, I think that's one of the best things we can do with this conversation, besides the education piece of it, which you two are doing, helping start the conversation. So, Jerry, I appreciate you being transparent. It's one thing to sit here and be like, you guys should talk about it, but when you come out and talk about your own issues, I think that's so much more relatable. So, to be even more transparent, I was just very curious about it. I'm a 30-year-old, fairly fit, healthy individual, but I was like, I'm curious, and there absolutely was a difference. There was. Mm-hmm. I'm not 20 years old anymore, and and that is something that we've talked about previously. What does that look like for individuals that have already had this procedure? Like, how long does this last? Do you have to do it again? Like, how does that look?
Yeah. So interesting enough, it depends on the reason that you had it for, and the time frame is different for everybody. So in terms of actually needing it, especially with our female patients, a lot of them have great results, and they may not come back for, a year and a half maybe, and then they'll have it repeated. We have the other end of the spectrum that they had good results, but the sex was so much better afterwards. They want to repeat it sooner because they like that initial boost, because it does the results of it. You continue to age, our bodies continue to age right on. We do something to temporarily try to, reverse whatever that problem may be. And so it is something that you will need some sort of maintenance on, especially if there was an issue that we were treating, whatever the underlying, issue was. Hopefully you will get it better controlled. Hypertension, for instance, maybe you're going to get your blood pressure better controlled. Maybe you're going to start exercising, but you're going to still continue to age. You will need it repeated at some point. And usually we say about a year and a half. Okay. But there are people that get it repeated at more frequent intervals, and that's usually just because of the actual, if they get out for stress incontinence, they may have an improvement. We tell them that's usually going to be 2 to 3 months down the road, because it takes a while for that, growth, the collagen production, et cetera, to kick in there. But then they'll tell us, hey, I really liked that initial, it was more lubrication, I was stimulated more easily, I had great sex for the first few months afterwards, and I want to have that again. And so that's, a more soft indication, if you will, to have it needed, something that I don't really need it.
And I think that's a huge point to make, that it's one thing to, all right, I'm going to go do it. I'm going to get it done that one time. But I think that speaks volumes to the people that are, I think that speaks volumes to anybody out there that is fearful of whatever this procedure may be. I think that's proof in saying, like, it's not that bad. If these people are willing to come back even before it's recommended, that speaks volumes.
Mm-hmm.
Yeah, we have a lot of repeat clients. I mean, they're usually, like I said, this is one of the procedures. By the time it's the making the commitment to get it to start with is hard, and
sure.
Then once they wrap their mind around it, they have the procedure, they realize it's not near as bad as they thought, they like the results, they come back and get it again. And again, hopefully in that time we are addressing like a whole host of other issues, communication, lifestyle changes, dietary changes, making sure that any underlying diseases are adequately controlled, referrals to appropriate specialists, etc. So,
and do you get the feedback of, I wish I would have done this sooner?
Yeah, especially from our, the middle-aged women, like all the time. We wish we would have known about this sooner. We didn't even know this was out there. We had no idea there was something that we could do. We thought this was just part of, aging.
Yeah, that makes sense because, before y'all brought it up to us, I was the same way. I didn't know that was a thing, but that's really cool. You got anything else?
I think that's it. No, it's so interesting that, two people that are practicing this very intimate thing don't talk about it.
Yeah.
And just breaking the ice with another medical professional just opens up all this other stuff that, they could have talked about at home and really figured out maybe sooner or, differently. I think that's really interesting that you guys really, with that questionnaire, really help people learn about each other that they're already in a relationship with. And
it's fascinating too. I think that the longer that you've been in the relationship, the harder those conversations are to have. You'd think it was the opposite.
Yeah.
But people early in relationships tend to be exploring each other, learning each other, learning everything about each other. There's all that excitement, but as time goes on, there's an assumption that you know that person, and that there's a familiarity, and that we just think, well, I know everything about them. They must like X, Y, or Z, and but that communication starts to slow down. That's not the same as it was in those initial, phases of exploring and developing the relationship. And so sometimes the questionnaires, just talking about it, with other people, or having, the book in front of you to say, hey, I didn't know other people had this same problem. It is enough to, jumpstart that conversation back to re-explore each other again, because that's one of the things that, when people have been in relationships 15, 20 years, to say, hey, I really didn't know this part about you. There's a bit of, how could I not know that about that person? Or how could they not know this about me?
Wow.
Or something has changed with my body in that 10 or 15 or 20 years. And so my body's different than it was when we first got together. And now I don't really want to point that out. And so it is kind of interesting how the questionnaires, the conversations can be jump started. And it's for people that are in these intimate relationships and shared many, many important life events and changes in life. But all of a sudden, this part gets harder and harder to talk about the further in the relationship they get.
Wow.
Kind of counterintuitive. We wouldn't think that, right? You would think by that point we're talking about everything. But oftentimes we need some kind of, jump start to say, hey, how can we get back to this and talk about what's really bothering them?
Yeah.
We've told this story many, many times to people, but it's, I still think it's kind of fascinating. Jerry, I told him when we first met, and he was moving. I was living in Chicago at the time. He was moving to Chicago, and I was coming out of a failed relationship, and we went to counseling at the end. And I said, why are we trying to have a counselor fix problems that we've had for 10 or 12 years that we've just continued to talk less and less and less about?
Wow.
And now we wanted this person at the very end and asking them to fix all these years of issues. So I said, we're going to do it opposite. When you move to Chicago, we're going to go to counseling from day one. And he thought I was joking.
That's awesome. I didn't know that.
Yeah. He moved on like a Monday, and I think I had our first counseling appointment on a Wednesday. And awesome. Literally, that's like new in a relationship, right? I mean, we're in that exploring phase. We're in that, we're learning everything about each other. And in my mind at the time, and I don't know, this is the best for everybody, but I thought, why not flip this around and why not go from the very beginning and try to set up some, better communication. Let's try to figure out how we can change this so we don't end up in another failed, relationship years down the road. And, he kind of scoffed at the idea. He can tell you his thoughts on it. He thought I was a little bit crazy, but new in the relationship, he complied. He went along with it. He went with me. And, we were fortunate. We had a wonderful counselor in Chicago, and we went every week, and we grew from that into doing some individual sessions, some, group sessions. And we did that for several years, and we've continued off and on. We don't do it nearly as regular now, but during periods of stress in our relationship, whether it's from family issues or death or, just, anxiety provoking issues, we've kind of touched base back, and we will do counseling. But I think that's really important to keep that communication open, and whatever tool you use to do that, whether it's a counselor or a book or, the questionnaire that we use when you come in for a sexual health evaluation. I think that's really important for your listeners to know that there are things out there to help them with that piece.
I think that's a really cool concept. That's right up my alley. I love that so much. Jerry, good on you for sticking around, because I probably thought you were nuts too, but like, that's so cool when you really flip that on its head. I like that a lot.
Yeah,
well,
it makes so much more sense.
It does.
Though, but that's not
she
the
showed
norm.
us how to keep it good.
Yeah.
It was young and fresh at the time, and so she showed us how to keep it there rather than. We'd both been in failed relationships.
Yeah.
And and both of those relationships ended up in counseling at the end when there was really no help.
Yeah. And there's always opportunity to improve that communication, because I feel that that's what, couples therapy is, marriage therapy, whatever you want to call it. I feel that at the base of it is most likely communication. So good on y'all for that. And so two things I wanted to say here. If you guys are wanting information from these two incredible individuals, we're going to link everything down below, and we're going to have you plug that information here soon. But so you said you refer people out. Do you refer people to therapy, like to emotional therapy?
Yes.
Okay.
Whether individuals or couples, yes,
Okay.
we do. And I think that's a really important part. And by no means are we taking the place of that. I think we're a conversation starter. We open that up, but if people need that, some people are open to it. Other people have other means that they want to use their minister, their, religious support. And I think everybody is different. But yeah, we refer out.
Awesome. Yeah. Y'all have all the tools. You'll have all the tools. I love it.
Yeah. That's so many things that I never really, didn't even think that you guys got that deeply into, people's personal lives. It makes so much sense, but I just never thought it through, honestly.
Yep. Well, let's do this. You think on the wrap up, and then y'all plug everything that they need to know, and we'll put it in the description below as well.
Perfect. One of the things that we're super excited about, we're doing this, obviously, recording this in the middle of COVID-19 pandemic. And there's been a lot of, different models to look at how we provide service and how we keep our patients safe during this pandemic. And so starting tomorrow, we are offering virtual consultations. We've been setting up our virtual consultation hosting service so we can do this online. That minimizes the amount of time our patients will actually have to be in the office. It gives us a chance to get to know them. And for people who are just, curious about some of these services or what we have to offer, we'll be able to, provide that for them safely. So we're going to do that several days a week. You can find information through that, for that on our website, which is www.JDCCSkincare.com. Matt will put that in the bottom there. You can also, we'll be posting this information on our Facebook page, Instagram accounts. But the virtual visits will be through our website on JDCC Skincare. And we can do a lot of the sexual health consultations without you ever having to leave the comfort of your home, and kind of go over what options are available, what further testing you may need before you come to see us. So we kind of have all of that in line by the time you actually show up at the office. And again, that's starting tomorrow. Also, for anybody watching this, if you like and share this on Facebook, we're going to offer 20% off of all of our plasma services, which is going to be for any of the sexual health procedures, the P shot, the O shot, but also we do this for other areas for facial rejuvenation. We can do a vampire facelift, vampire facial, but we're doing a lot of different plasma-based therapies. Feel free to email us, message us, or sign up on our website for a virtual consultation, and like and share this, and we will offer you 20% off of those services through the end of June.
Heck yeah, man.
Awesome.
I love it. I love it. So, and we've been sort of privy to watching Chris and Jerry build up this practice, which, I mean, we weren't there for the infancy, but we sort of came in to some of this, and it's really been cool from one business owner to another to see y'all adopt, some of the technology pieces. Y'all know I'm kind of a gearhead when it comes to all the technology and doing all the stuff. So it's cool to see y'all adopting that and adapting. So good on y'all for the virtual piece. I love that so much. Mm-hmm. Super cool. Jenna, what's the wrap up of this bad boy?
Something I've been sitting here thinking about is that, the general assumption is that sex isn't as good farther into a relationship or the older you get, and that doesn't have to be the case. It just takes some communication and, kind of putting yourself out there, and it's so worth it to do that, because I think that there is that snowball effect. There is that, domino effect of you have that very intimate part of your life figured out, and that gives you that confidence. It gives you, that boost in your relationship. I think that's a big piece to get figured out.
It is. It truly is. This has been really, really good. This flowed really, really well. I loved how this went. You guys, I think all four of us did a great job of mixing the health aspect of the, physicality piece, the objective piece, and then also, a lot of the subjective, a lot of the emotional, mental piece. So this has been fantastic. You guys, you got anything in closing that you want to say?
Just kudos to you guys for kind of taking a leap to do this. I know it wasn't something that you typically do on your podcast, but just putting it out there that, there's not just treatments for diabetes and hypertension, that there's also treatments available to maintain this sexual health component that makes us all human. And so Thank you guys for having us.
Yeah, thanks again for having us. We always enjoy being with you.
Absolutely. Well, this will definitely not be the last time. This is now the second time that they've been on here. Episode 50, they both came on, and we were talking about COVID whenever it was sort of hitting. And what I loved about that episode was that you both brought facts. You went away from the media and you just brought facts. And that's exactly what you did again here today. This has been a blast. Thank you guys so much. Jenna, I think you got something you need to say.
No.
Yeah, you do. Remember? Was at the top of the show you had to do that thing? Remember? Do the thing.
I don't.
Do the thing.
I'm not good at it.
Do the thing. Do the thing.
I don't know where to start.
If you guys want to support us, go to Patreon. There's a link in the description below.
Oh, well, that was easier than I thought it was going to be.
Yes, I know. Also, check out all of their information. Chris and Jerry, thank you guys so much for being here. We'll talk to y'all next week.
Sounds good.
Sounds good.
This has been the Better Than Yesterday Everyday Podcast. We want to thank you for listening and invite you to subscribe to the show as well. And follow Matt Lane Fitness on YouTube. Until next time, you don't have to be perfect. Just be better than yesterday, every day.
Yay, sex.